Hello and welcome to our webinar, and thank you for joining. This webinar is called Implementing the HEARTH Act in Virginia. My name is Anna and I work for the National Alliance to End Homelessness. Your presenter today will be Norm Suchar, Director of the Center for Capacity Building at the National Alliance to End Homelessness. This webinar is being recorded and will be available online at a later date. Currently and throughout the presentation part of this webinar, you will be muted. At the end of the webinar, we'll be able to unmute you so that you'll be able to ask questions. To do that, you may want to call in with your phone. On the panel on the right side of your screen, you'll see an audio panel. This will explain how to call in. If you have a microphone and speakers on your computer, you may not need to call in with your phone. So without further ado, here's Norm.
Thank you, Anna, and welcome everybody to the webinar. As Anna said, we'll have time for questions later. You may also have a box that allows you to sort of type in questions, but it may be better to go ahead and ask them when we get to that point in the webinar. We're scheduled to go for 2 hours. We don't anticipate that it will necessarily be that long, but we wanted to leave as much time for people to ask questions as you wanted. So the presentation will probably be about half an hour or 45 minutes or so, and then we will go to questions, and we may be done early if there aren't too many questions, or we'll go the full 2 hours if people have a lot of questions. So the other thing I wanted to say is that the way the webinar works, software works, is that I'll change my slides, and sometimes there's a bit of a delay before it comes up on your screen. So if that happens, just sort of be patient and the slide will change. And I'll try not to get too far ahead of everyone. So our agenda for today, I'm going to talk a little bit about the Continuum of Care Interim Rule, and we're going to talk about a few of the sort of the big things that the HEARTH Act is changing, and the changes you'll see coming up in the next few months, and in some cases longer term. So those include coordinated assessment, the emphasis on shifting resources, and changes to how governance works. So we'll start by talking about some of the changes to the interim rule. I'm not going to go through all of the changes. It was a fairly lengthy interim rule, so there are a lot of changes, and there are a lot of details in there. I will say right off the bat that we have produced a summary of the interim rule changes that's available at our website, and you can actually get to the summary from the homepage of our website at endhomelessness.org. HUD has also produced a few different summaries and some other material that's very good that explains the interim rule, and that stuff is all available at hudhre.info. So let's start by talking about the timing of the rule. And let me actually just back up a second and talk about the sort of the rule process here. This is an interim rule, which means that it's going into effect immediately, but there will be a comment period, and the rule may change again once HUD has had a chance to review all those comments. So everything that's in the rule today is not necessarily the final word, but it will be in effect at least for this this coming funding cycle. So with respect to the timing, the rule has technically already gone into effect. It went into effect August 30th, although it's affecting the next cycle of grants. So these are the grants that is a COC funded program. You would be applying for either a new grants or renewal grants in the upcoming NOFA cycle. That should NOFA should be published sometime in the next several weeks. So even though the rule is in effect now, it's only going into effect for those grants that are funded by that funding round. Comments to the interim rule are due to HUD by October 1st. We strongly recommend that you take a look at the rule. I think you'll notice probably a few things on this call that you might think either work well or don't work well for you, but there are probably other details in the rule that are worth commenting on. I know that HUD takes these comments very seriously, reads and pays attention to every single one of them, and they frequently result in changes to programs, and generally they're changes for the better. So strongly encourage you to comment. So let's talk about the different components. So the way that HUD it breaks out the new COC program is that instead of having a shelter plus care program, a moderate rehabilitation single-room occupancy program, and a supportive housing program with different flavors, there's just one overall program, one overall continuum of care program. But there are sort of 5 components or program types, if you will, and they are as follows. The first one is permanent housing, and there are 2 types of permanent housing. There's permanent supportive housing, which looks very much like the permanent supportive housing that I think everyone is used to, that either the type that is funded through shelter plus care grants or the type that is funded through supportive housing program permanent housing grants. So those types of grants will continue, and both you can get those grants renewed and you can apply for new permanent supportive housing grants. So that's one type of permanent housing. The other type of permanent housing is rapid rehousing. Rapid rehousing, if you were a recipient of HPRP rapid rehousing funds, or if you were working with the new Emergency Solutions Grant program, this new rapid rehousing activity will look pretty familiar to you. You can provide rental assistance for up to 24 months, anywhere from 1 to 24 months. In addition, you can provide other types of financial assistance, including things like utility deposits, just regular deposits, first and last month's rent, and things like that. In addition, with respect to rapid rehousing, you can provide services along with the rapid rehousing financial assistance, and the services are a little broader than the ones that you were allowed to provide under HPRP or under the new Emergency Solutions Grant. Basically, any type of services that you've been able to provide as a COC-funded program, you can provide as a rapid rehousing program, and the sort of stipulation is that it has to be towards the goal of helping people move into or maintain permanent housing. But all those activities that you've been able to provide as, for example, a permanent supportive housing or a supportive services only or a transitional housing provider, you can provide in conjunction with a rapid rehousing grant. So that's component 1, permanent housing. Component 2 is transitional housing. A couple differences in transitional housing from the way it used to work. Program participants, so the tenants in transitional housing, have to have a lease, and the term of the lease has to be at least 1 month and not more than 24 months, and cannot be extended. Otherwise, transitional housing is fairly similar to the way it's currently operated. And again, if you currently have a transitional housing grant, you can get it renewed and operate the program largely similarly, although I'll talk about a couple differences in a minute. There are also supportive, so that's permanent housing component, transitional housing component, supportive services only is a third component. Those grants cover things like street outreach and other supportive services only projects. So one of the sort of somewhat confusing things about the way HUD categorizes these programs is that the supportive services only category is for grants that don't provide any kind of housing assistance or rental assistance. They just provide supportive services. but you obviously provide supportive services in other program types, especially in permanent supportive housing and transitional housing. So that's the third component. The fourth component is HMIS, and those costs, eligible costs, are similar to what they are now. I will say there is even more of an emphasis in the new HEARTH interim regulation and overall in HUD's strategy for implementing the HEARTH Act and in implementing its continuum of care programs. There's an even greater emphasis on HMIS. I'll talk a little later about performance, and I think it'll sort of become clear how important HMIS is going to be for evaluating performance going forward. One sort of policy change that HUD's made, or at least sort of a change in emphasis, is they're encouraging every COC to have only one HMIS. I think that's the case in Virginia, although there are some other continuums in the country that use where they use more than one HMIS. That won't be allowed going forward. So that's the fourth component, HMIS. The fifth component is prevention, but I just want to caution that prevention is only allowed in a specific circumstance, and that circumstance probably isn't going to apply to anyone for a while. So prevention is an allowable activity for communities that apply for and receive the designation of being a high-performing community. So the HEARTH Act sets out criteria for what it means to be a high-performing community. It means that you can measure the average length of time that people are homeless, and that that length of time is either declining significantly or it is less than 20 days. And it also requires that you can measure the rate at which people who exit homelessness become homeless again, so the rate of return to homelessness. And again, that rate has to be either declining very significantly or it has to be less than 5% over the course of 2 years, which is, both of those are very, very high standards. And as you can tell from the measurement, it's going to take at least 2 years of data gathering before anyone can really measure their rates of return to homelessness. So prevention is not going to be an activity that's going to be allowed for most people through the continuum of care, at least for a while. Just as a note, prevention is an allowable expense for the Emergency Solutions Grant. These are grants that are provided to city, county, and state governments. So there is prevention money coming through HUD, but it's not through the COC program. So those are the components of the new COC program. I want to say a few words about rapid rehousing really quick, a few more words. We've learned a lot about rapid rehousing because of the experience of HPRP. I'll talk a little bit about that as we go through this presentation, but a couple things I wanted to say. One is that the rental assistance is for up to 24 months. This is different from HPRP, where it was allowable for up to 18 months. The permanent housing activities, and this is potentially a pretty significant issue for a lot of people, the permanent housing activities, so both permanent supportive housing and rapid rehousing. If there's rental assistance attached to those programs, and that would pretty much always be the case with rapid rehousing and is often the case with permanent supportive housing, that rental assistance has to be administered by either a local government agency or a public housing authority. So they can't be administered solely by a nonprofit organization. So that's one sort of significant issue with the rapid rehousing programs that I think people are going to have to look at. The participants in rapid rehousing programs will be required to meet at least monthly with a case manager. and they will have to have an evaluation of their eligibility at least once a year. So this is different than was the case in HPRP. The recertifications had to happen every 3 months, or that evaluation of eligibility had to happen every 3 months. In this case, it's at least once a year. And again, there's the requirement of meeting with a case manager monthly. Also, the services that are provided as part of a rapid rehousing program can continue for up to 6 months after the rental assistance ends. So that's another requirement of rapid rehousing programs. Another change to that the interim rule makes is about continuum of care boards. The regulation, the rule states that COCs have to establish a governing board within 2 years of when the regulations are enacted. So essentially within 2 years from now. The board has to be representative of the subpopulations of homeless people within the continuum of care's geography. There has to be at least one homeless or currently homeless or formerly homeless person on the board. And then also recipients or subrecipients of continuum of care funds will also be required to have at least one person who is homeless or formerly homeless on their organization's board. I will also say that in the interim rule, the HUD has requested, HUD has made some other suggestions for the composition of the board, including how often they turn over and other issues like that, where they haven't implemented them, but they've essentially said, we're thinking about these things, and we'd like your comments on them. So that, I think, is an example of something that's worth looking at and thinking about whether you want to provide comments to HUD about whether the COC board that they are sort of envisioning makes sense or not. But those are not in the rule now. Those are just things that could potentially end up in the final rule. We'll talk next about some issues with respect to the definition of homelessness. There's been a lot of stuff about the definition of homelessness already published. The final rule about the definition of homelessness came out in January of this year. So that's not a rule that's up for comment, and it has been finalized. Some of the changes in the definition of homelessness, I know many of you are probably already familiar with this, but I just want to recap quickly and add one thing. Some of the changes are that it was previously the case that people who were about to become homeless, they were going to lose their housing within 7 days, could be considered homeless and eligible for continuum of care homeless assistance programs. That has been extended to 14 days, and in addition, there are a lot of there's more specific guidance as to how you document those things and what kind of documentation is acceptable. So there's been an extension of that category of homelessness. In addition, there's a new category of homelessness. This is sort of, some people sort of describe this as the couch surfing category, people who are moving from place to place. And that category involves people who are families with children or unaccompanied youth who are highly mobile, so they have moved at least twice in the last 60 days and have not had a lease or have not been a homeowner within those 60 days, and they have some sort of circumstance or condition that's going to likely lead to them continuing in that circumstance. The rule that governs the definition provides a list of what those circumstances are. So that's another category of homelessness. So people in that category will be eligible for continuum of care assistance. And then there's another category that was always allowable, but it's now sort of its own little category, which is people who are fleeing or attempting to flee domestic violence situations. So again, there's a lot of description of what the documentation standards are for serving somebody who's fleeing domestic violence. But all that is covered in that rule that was published earlier this year. The other change that I wanted to cover is that there is a provision in the HEARTH Act that allows communities to allows continuums of care to apply to HUD to allow them to serve people who are not categorized as homeless under HUD's definition of homelessness, but are categorized by some other federal agency as homeless. This mainly applies to the Department of Education, which has a much broader definition of homelessness. There are certain circumstances under which you can apply to HUD to allow that would allow you to use some of your funds to serve that population, and it has a set of goals around housing stability, and you have to be able to demonstrate that it would be beneficial to your community to do that. So there is that allowance there. But that would essentially, that's not something that's automatic. That's something you would essentially have to apply to HUD to be granted that ability to serve people who fall into that category. Lastly, I want to talk, at least with respect to the interim rule, I want to talk about administrative funding. So there are two kinds of big changes to the way administrative funding works. One is around project administration. So currently, depending on what kind of grant you operate, you can get up to, for most people, it's up to 5% of the cost of the project can be used, or 5% of the grant can be used for administrative expenses. So that's changing. The HEARTH Act allows that up to 10% be used for administrative costs, project administrative costs. But there are a couple sort of important nuances there. One is that HUD is encouraging people to use only up to 7% for administrative costs in the first year. The reason for that is there just isn't as much money as it would take to really have every project out there moving up to 10%. So if you only use up to 7%, you'll get extra sort of bonus points in the upcoming NOFA. But if you would like, you are allowed to use up to 10% for administrative costs. It's complicated, but what HUD's going to do is essentially in your renewal, when you go to renew a project, they will sort of build in up to 7%, but if you wanted to shift money from another line, you could shift it and use up to 10%. So it is technically allowable currently. Your COC will probably lose some points if you go all the way up to 10%, but we will eventually get up to that 10% level. So that's how project administrative costs work. The other type of administrative costs, and this is a new category, is COC administrative costs. So these are grants for sort of planning and coordinating the entire COC. They would go to the lead agency, and the HEARTH Act allows up to 3% to be used for those administrative costs. HUD is in the first year, again, because Congress just didn't provide enough funding to do all of the new stuff in the HEARTH Act. HUD is going to allow up to 1.25% or up to, now I seem to have forgotten what it was up to 1.25%, or there was a maximum amount, and I can't off the top of my head remember what the maximum amount is, but I'll look that up and get back to you about that. But that's for the larger COCs. So up to 1.25% will be allowed for that project, for that continuum of care-wide coordination and planning. Currently, there's no administrative funding available for that function, but now there will be. So that sort of covers the big parts of the interim rule. Again, there are some very good summaries of the interim rule available at our website and also available at the HUD HRE site. So next I want to talk about performance measures. Because this is really, over the long term, this is really the big change that the HEARTH Act makes. I mean, this is really going to have an impact on the shape of homeless assistance if you're thinking about 3, 5, 7 years from now. So currently, I think if you're running a continuum of care project, you're familiar with the performance measures you're required to report on. If you're a permanent supportive housing project, for example, the rate at which people stay for at least 6 months. If you're a transitional housing project, the rate at which people who exit are exiting to permanent supportive housing, et cetera, income and employment, and things like that. So the new performance measures I've listed here. There's one thing that I didn't list, and I'll talk about that in a second, but it won't apply to most people. But these are the 7 performance measures that are included in the HEARTH Act. And I've highlighted, I've italicized 3 because I think they're sort of unique and important, and I'll talk about those more in a second. But the 7 measures are to reduce the number of people who become homeless, to reduce the length of homelessness and homeless episodes. So this is different than the measuring just the length of stay in a program. This is intended to measure the length of time somebody is homeless from the time they become homeless to the time they exit homelessness overall. So if somebody becomes homeless and stays, say, in a shelter for 30 days, and then in another shelter for 30 days, and then in a transitional program for, say, 100 days, then their overall length of homeless episode is going to be 160 days. So that's what that performance measure is going to measure. The rates of return to homelessness is another measure. So again, this is not the rate at which people return to a program, but that they return to any program in the continuum of care. So if someone exits, say, one shelter, they're in permanent housing, but a few months later they come back to a different shelter, that will sort of count as a negative score in your in this measure. Another measure is reducing overall homelessness. This sort of combines the 3 measures previously. The increasing jobs and income is another measure. This is, I think people are pretty used to reporting on this one. And then there's a category of just other accomplishments. And then there's another measure which is the thoroughness in reaching the homeless population. And this is partly to combat the problem of or the circumstance where a community or a project may find that they can improve their score best by just by sort of not counting or not or making it difficult to access homeless assistance. So that measure is sort of intended to counteract that possibility. The one other measure that's actually included in the HEARTH Act deals with that category of people not defined by HUD as homeless, but defined by other programs as homeless. And there's another measure of housing stability that would only apply to those COCs that use that flexibility. The other thing I sort of want to mention about these measures is that these are continuum of care wide measures as opposed to project level measures. So this is not reducing the number of people who sort of come to one program. It's the number of people who become homeless in the continuum of care, geography. So this is going to be a pretty big change in the way people measure stuff. There's going to be much more reliance on HMIS. HUD is kind of ramping up the requirements that everyone participate in HMIS. whether they're funded by emergency solutions grant funding or continuum of care funding or any other kind of funding. So more requirements, more incentive to do HMIS, and one of the big reasons is these are the kinds of things that the HEARTH Act is requiring that everybody measure. So that sort of covers the changes in the interim rule and in the HEARTH Act more generally. There are sort of three more things that that we're going to talk about. The first is coordinated assessment. So one of the things that HUD is requiring is that people participate in a coordinated assessment process. This sometimes gets sort of talked about as centralized intake, and that's certainly one of the options for coordinated assessment, but not the only one. Here's how HUD describes coordinated assessment, and this should be coming up on your screen in a second here. But it's a centralized or coordinated assessment is a process designed to coordinate program participant intake, assessment, and provision of referrals. It covers the geographic area, is easily accessed by individuals and families seeking housing or services, is well advertised, and includes a comprehensive and standardized assessment tool. There are several different potential models of coordinated assessment. And I'll talk about each of these just briefly, but HUD is largely leaving it up to continuums of care to decide which model makes the most sense, and I think it, depending on your geography, this is going to vary. There's a centralized intake model where there's maybe one or two locations where if a person is homeless, they go to those locations, they receive an assessment, they get assigned to a program, etc. There's a decentralized model where you have numerous intake locations positioned around your city, county, region, or state, depending on what kind of geography your continuum of care is. There is phone-based or 211 systems where people call in to access homeless assistance. There's a mobile case manager model where the sort of the intake comes to you. So potentially a person in a car that just goes around with a laptop and does intakes. And then what's going to be common is that people utilize a couple of these strategies simultaneously. So for example, a lot of people layer 211 and either a centralized or decentralized kind of approach where a person first gets screened by 211 and then they can either get a referral there or get referred for more comprehensive assessment at a centralized or location or at one of many locations. So we have a few sort of suggestions for how to think about planning and creating a coordinated assessment system. Number one is to pay attention to domestic violence survivors and their needs. HUD is, in the interim rule, HUD has requested a lot of comments about how to make this work best for domestic violence survivors. Safety is obviously a huge consideration. Domestic violence providers have different data requirements than other providers, so that has to be taken into account with the coordinated assessment system. But one of the real opportunities that a coordinated assessment process offers is to better integrate homeless assistance and domestic violence assistance. One of the things we commonly see as we look at how domestic violence survivors receive assistance is that there's a disconnect between the domestic violence system and the homeless assistance system, so that someone goes to a domestic violence shelter, but they can't take advantage of, for example, rapid rehousing programs or other programs that are offered in the homelessness system. Or the other thing that happens is if the domestic violence shelters are full or people are just unaware of them, they go to the regular homeless assistance system and they're unable to access domestic violence services. So the coordinated assessment process offers an opportunity to really integrate those things, but the planning has to be you have to plan carefully to make sure that you're both meeting those needs for integration, but also taking into account the safety needs and accommodations that domestic violence survivors need. The coordinated assessment offers a great opportunity to reorganize prevention assistance and shelter diversion assistance. So one thing we've noticed is that in a lot of communities there are a lot of different kinds of prevention assistance that are available, but it's a pretty hard thing to navigate. And what coordinated assessment offers is the possibility of consolidating a lot of different kinds of prevention and homelessness diversion assistance. So, for example, you can have the applications or assessment for a variety of different interventions, a variety of different prevention programs all happen at the same time in the same place. There are many different kinds of prevention and diversion screening tools that are available. There are several on our website. It's pretty easy to screen for whether a person is a good candidate for homelessness diversion. It's also the point at which people access an intake, a centralized intake or a coordinated assessment system when they're seeking homeless assistance is actually a great time to make a last-ditch effort to salvage whatever housing situation they're in. And this can often happen. So if they're being evicted or a family member is evicting them, to have case managers available who can quickly try to repair the situation, even if only for a few weeks or a couple months, while you work on a longer-term housing strategy for people, and thus you can avoid a homelessness episode altogether. The coordinated assessment process offers a great opportunity to really break down program barriers. So the way coordinated assessment is supposed to work is that if a person becomes homeless, they go through the coordinated assessment process, and then they get assigned to a program. And this gives your community a chance to really look at all the people who are becoming homeless in your community, all the types of programs you have available, and say, okay, well, the people with these barriers, how are we going to handle this? Where are we going to refer them? How's this going to work? What we find in a lot of communities is that there are people who can't really access any of the programs in their community, either because of some barrier they have. For example, in some communities, there are no places that will take say, a young person with a substance abuse problem or something like that, or a couple with children or something like that. So this gives your community a chance to really look at all the look at the characteristics of people who are becoming homeless in your community, look at the programs, and really say, okay, we have no good place for this circumstance. So let's work with people on removing barriers so there's a place for everyone in the system. So this is a great opportunity to do that. This also gives a chance to really sort of create written standards based on best practices for how people should be able to access assistance. Another thing we've noticed in a lot of communities, and I think HUD's noticed, which is why there is a requirement for coordinated assessment, is that access to programs can sometimes be subjective, or the process for accessing programs isn't well known, and this gives a chance for everyone to really understand how you access different kinds of assistance and who's accessing different kinds of assistance. One thing we strongly encourage is that if you have in your community a program that's really service intensive, a more expensive type of intervention, that the households that have the most difficult barriers to being rehoused should be the ones who are accessing those kinds of programs. So just for example, if you have like a 2-year intensive program, those should be serving some of your highest barrier households. And so the process of developing a coordinated assessment is really an opportunity for you to map that out and figure out how that's going to work. And then another thing we encourage people to do is to use a progressive engagement approach. So another thing we've noticed is that it can be, especially when someone is coming for homeless assistance for the first time or when they're in crisis, it can be really difficult to assess what their long-term needs are going to be. And what communities are starting to do, and I think pretty effectively, is they're using the approach of, okay, we'll start with a small level of assistance. We'll provide, for example, lists of landlords. Maybe we'll pay rental application fees and things like that. And if that works, that's great. And if it doesn't, then we'll step up to the next level of assistance, maybe a short-term rapid rehousing program. And again, if that works, that's great, and it will work most of the time. But if it doesn't, then that's when we know we have to use our more intensive programs, our longer-term transitional housing programs, permanent supportive housing, et cetera. Sort of related to the last one, but it's important to create very clear policies and procedures. HUD is requiring that every continuum of care have a written process that is both written down and followed for determining how people are going to be assessed or how people are going to be assigned to rapid rehousing, to transitional housing, to permanent supportive housing, and also a written process for determining how decisions are going to be made about how much rental assistance people are going to be provided. So those will have to be spelled out and clear, and the great thing about a coordinated assessment process is it gives your whole community a chance to really come together and work on that rather than one sort of provider having to do their own and another one doing their own, and these things don't match well, et cetera. So that's all I wanted to talk about with coordinated assessment. We're going to talk for a few minutes about shifting resources. So this has been something that HUD has started encouraging. And I want to start by just looking at some data. This is not data from anywhere in Virginia. This is actually some data from Alameda County, California. And I just want to show it for 2 reasons. One is that, well, let me back up for a second and just say, obviously there's a lot more emphasis on performance and improving performance in the HEARTH Act and in the new Continuum of Care programs, and there are different ways to do that. And I think what some of these slides show, and just start by looking at the slide at the top left that looks at permanent housing exit rates for shelters, is that programs can have wildly, and what you see there is the percentage of people who are exiting various shelters who are exiting to permanent housing, and the numbers you see along the x-axis, the 51, 2, 23, 7, et cetera, those are just identifiers for different providers. So this is a way to sort of do this kind of anonymously, to publish data about performance anonymously. But you can see there can be wildly different outcomes from different programs. And some of these may make sense, like maybe some programs are serving people with a lot more barriers. But in some cases, they don't make a ton of sense. And it really is, there are some programs that are just designed better. People try different things. Sometimes they work, sometimes they don't work. And what this, this allows you to do is really sort of look at what people are doing that's working really well, that's getting good outcomes, and being able to share those strategies between different types of programs. So there's a lot of progress that can be made just within a specific type of, within a specific program type. So transitional housing at the bottom, similar story. There are great performers, and then there are not great performers. And then the other thing I wanted to show, the chart that's sort of at the top right about returns to homelessness, and it shows rates of return to homelessness for people who exited different types of programs. And what you can see is that different types of programs have different performance. So it's not just that, you know, shelters can perform differently, but that a shelter model will perform differently than a transitional housing model, which will perform differently than a rapid rehousing model. And it's important to understand the differences between those things. And that's all going to be part of the shifting conversation. So the conversation is really about 3 different kinds of resource shifts. There's resource shifts that are sort of within a program. So you can, if you're a provider, you can look at your budget and say, okay, we're spending money on this, and this is not working as well, so maybe we should shift resources to some other activity. Maybe you're realizing that you need more rental assistance, you don't need as much case management, so you'd shift resources from case management to rental assistance, or maybe you're seeing precisely the opposite, that you are able, maybe you can leverage rental assistance, or maybe people don't need it as much and you need more case management or something like that, and so you shift money within a program. Or you're a shelter program and you realize your case management is doing a good job, but you really could use a person who's doing more housing location and working with landlords, and so you'd shift a case manager to that. So there are shifts within a program to just make it perform better. There are shifts between programs. So as the chart earlier showed, there are some, for example, shelter programs that are performing better and some shelter programs that are performing worse. And you may want to take the opportunity of the COC NOFA process and really shift from one program type to another, from one program to another. So, cut one shelter program's budget. I guess you wouldn't necessarily fund shelters through the COC, so maybe transitional housing, you would provide less funding for one transitional housing program, more funding for another transitional housing program, for example. And then there's shifting resources between different strategies. And I think this is something that's rightly gotten a lot of attention, and it's going to be an important part of really improving performance going forward. That's really looking at the strategies that you have in your community and trying to determine whether that's the best mix of strategies to get the performance that HUD and the HEARTH Act are expecting. And the big shift that I think people are looking at is shifting resources from transitional housing programs and some of those longer-term programs that probably contribute to longer lengths of stay in homelessness, and shifting to more rapid rehousing models where people are exiting homelessness quicker and moving into permanent housing more quickly. So those are so when we talk about resource shifts, it's not just about taking money from one provider and giving it to another, although that is certainly one of the ways it can be done. It's also making subtle shifts within a program, and it's sometimes it can be helping a provider switch from one strategy to another. So all those things are sort of in the mix with respect to resource shifts. HUD has sort of described a couple of different processes for shifting resources, and I'll just talk about the 2 main ones. One is reallocation. So people can shift, and what I've literally done is copied and pasted slides from an Interagency Council on Homelessness presentation that happened almost a year ago. And so these slides are from that presentation. You can find it on the ICH website, along with a lot of other good information. But the one process is reallocation, where you're literally taking a renewal project and not funding a renewal project, and instead you're going to fund something else. So this is an option for most communities, and you can reallocate from pretty much any project type to either a permanent supportive housing, a rapid rehousing, or an HMIS project. So there are a couple nuances here. One is if you're in hold harmless status, and if you're not familiar with that, your COC lead agency is certainly familiar with that term. But basically, your community gets enough funding just to renew all the projects and maybe one bonus project. If you're in that status, then it's called reallocation. There's sort of a process that you go through to do that. If you're not in hold harmless need status, which means that you're, in addition to just funding your renewals, you have more money that you can use for other types of new projects, not just bonus projects. Then the reallocation process, again, you don't really call it reallocation. You just wouldn't fund a renewal, and you'd be able to fund new projects under that process. But it works similarly. So that's one process, reallocation. HUD has sort of described how that might work. And you'll see more information about that in the NOFA when it comes out. The one thing I will say is if you would like to do some reallocation, you should talk to your COC lead agency right away. Actually, it would be better if you had already talked to them. And you should be in communication with the HUD field office right away if you want to get in on this, do reallocation in this grant cycle. The other option is repurposing, and this is really about modifying existing programs. So when we talked about shifts within a program, this is kind of what we were talking about. This doesn't necessarily have to happen during the NOFA process. It can happen at any time during the year. So but there's a limit to what kinds of changes you can make. You're going to have to, this is for changes where you're still the same kind of program. So if you were a transitional housing program, you're still a transitional housing program. You wouldn't use this process to go from transitional to permanent housing, for example. You would use the reallocation process for that. But this can be done anytime during the year. And again, talk to your COC lead agency and talk to your field office about this. Just to give some examples of different things people have done, I mentioned earlier shifting a caseworker from focusing on traditional case management to focusing on housing location. But for example, in one community, there was they had line money in their budget for doing things like drug testing that they didn't want to use it for that anymore. They wanted to use it on more housing location, and so they shifted grant money from that line to the other line. So those are the kinds of things you can do with repurposing. I want to talk quickly about governance and some of the keys to successful governance. I talked about the board that COCs will have to create. There are a few other things a few other suggestions I want to talk about. We work, the Alliance, we work with a lot of different communities around the country, and we've been able to tease out some lessons for which communities function really well, get good performance, make progress, and which communities struggle with that, and what are the differences, and what are those keys. And so this is kind of a summary of some of those keys. One is that data is just really important, and it's important for a few reasons. One is I think a lot of people have sort of an intuitive sense of what's working in their community and what's not working. And sometimes when you look at data, you find that you're right, and oftentimes you find that you're wrong. It's just important to know that. But just as importantly, it's data's your entry into a lot of different other kinds of funding and really integration with a lot of more bigger funders and mainstream resources. So data has, for many communities, really been an avenue to attract more resources to homeless assistance. So that's a couple reasons to really focus on data, in addition to the fact that HUD is just requiring that everyone participate in HMIS, and the performance measures are really going to require good data. So when I say don't skimp on data, it's not just good computers and software and such. It's important to have someone who can look at your community's data and really do some analysis and say, it's not just about producing the AHAR or the APR or the data needed for the NOFA, but to really say, okay, this, 6 months ago, or the average length of time people were homeless was this, now it's 20% longer, what's going on, what can we do to help solve that, et cetera. It's important to have people whose job it is not just to sort of fill out the NOFA application and to make sure everyone's in compliance, but to really look at coordination across different programs in the community. I think a lot of people try to do this by having regular meetings between providers to talk about coordination, but that's just a really challenging way to try to coordinate. And if it's at all possible, it's really important to have someone who that's what they do, that's their job, that's the thing they pay attention to all the time, and they can both look at data but really look at how people are accessing and moving through different programs in the community and make changes and to sort of improve the coordination of those programs. It's important to have good incentives for performance, for performing well. And we often sort of talk about accountability as, you just won't get funded if you're not performing well. It's just as important to have positive incentives for good performers. But it's really important to really look at not just the NOFA as your accountability mechanism, but to really look at all the tools you have at your disposal, whether you have funders who are willing to sort of use performance-based funding models, or I know of one community that gave a prize for the top performer and the most improved performer. So there are a lot of different, even simple recognition and things like that, and awards and things like that can make a huge difference. It's just if you want to become a community that performs well, it's important to pay attention to when people perform well and really have a set of incentives available to make sure that everyone else knows and that it matters whether your performance is better or not. I know that everybody who gets in this line of work obviously wants to do a great job, but it's important to be able to recognize in a more public way and a financial way who's doing well. It's also important to really give people who are not performing well to be able to identify those programs that are not performing well and to really give them an opportunity and the resources they need to improve their performance. I think we often talk about, just defunding as the hammer to make sure that people are performing well, but it turns out that a lot of low performers can improve their performance dramatically. They want to improve their performance dramatically, and with a little assistance, sometimes technical assistance, sometimes sharing strategies with other people. Sometimes it's as simple as changing their program design a little. They can really improve their performance. So it's important to have those other incentives. It's important to bring in other funders to your continuum of care process. One thing that people often rightly complain about is that funding is uncoordinated. You get funded by one person to do one thing, one person to do another thing. Sometimes they're at cross purposes. Sometimes it leaves huge gaps in what you need to do or what kinds of assistance you need to provide people. Having larger funders in the COC process can really help alleviate that. Some of those other funders, and by that I'm talking about your local governments, your different government agencies, your nonprofit foundations, your United Ways, and then also, just not to put it too crudely, but just people who have a lot of money, so rich people who are interested in doing a good thing and funding homeless assistance, and who often have a lot of, I think, savvy about fundraising strategies. So bringing them into the process is really important. And then getting a consumer involvement in a real and meaningful way there's the requirement that people are involved in the board, and that is helpful. But it's also really important to get much more robust consumer input. And so, and I think a lot of providers do this, but it's tough to be a provider and to ask people about how, what they think of your program, because they're receiving assistance from your program at the time. So it's a really hard thing to do. So, having focus groups, having your COC, if the COC lead agency or another sort of more independent entity can have focus groups and really ask consumers what's going on. Are you being treated well? What's making it hard for you to move out of homelessness and into permanent housing? What are the things that, the people you're working with are doing really well, that you like, that we should be doing more of? Those kinds of things are going to be really important to your process. The last thing I want to say really quickly is that I've sort of skimmed through a lot of stuff. The interim regulation has a lot more detail in a lot of cases. One thing that I didn't talk about that I'll just double back on now is that one of the requirements for all programs is going to be that people who provide disability-related services, those disability-related services, those are going to have to be voluntary services. You can't sort of mandate services based on a person's disability, regardless of the type of program you're operating. There are some other types of non-disability-related services that can be mandatory, but I will say there is certainly this movement away from mandatory services and toward more voluntary services in general, and HUD is going to be requiring that of those COC-funded disability-related services. So that's another change. So there's a lot of stuff. So I'd obviously encourage you to read those interim regulations and to make comments to add about those. Now at this point, we're ready for questions. And I'm going to turn it over to Anna to describe the question process.
Sure. Well, if you want to ask a question over the phone, there's some instructions for how to call in here. If that isn't working for you, I've had one or two people say that it isn't working for them. You can also type questions into the chat box, and I will read them aloud. So if you want to ask a question on the phone, you can click the Raise Your Hand button, and I will unmute you and say your name, and then you'll be able to ask a question. Also, this is a pretty common question that we get. I just want to make sure everyone knows that this webinar is being recorded and will be available electronically in a week or so. We will email you the link to that. So yes, so let me get started with a question that came in on the chat box just to get us going. Where can people find examples of written standards based on best practices?
So that's a very good question. So I will say that we have published a toolkit on doing coordinated assessment. That has some of that information, although we are also developing some materials that specifically answer that question. So again, there are some tools available at our website. Our website is endhomelessness.org, and you can either search for a coordinated assessment, for example, or you can just sort of just poke around in our website, and it's pretty easy to find. So we have some examples. I know HUD is working on developing some more materials around this, although I don't know that they'll necessarily present them as, these are the best practices. So I think the best thing to do is probably to stay tuned for some of our stuff. Look at our coordinated assessment toolkit, which just if you're navigating our website, I will say we have a button that's at the top that says training, and then there's one that says front door strategies, and that includes both a coordinated assessment toolkit and a prevention and diversion toolkit, and those include a lot of materials about best practices and things like that. But again, we're working on trying to create some stuff that's a little more specific to HUD's. We published that toolkit prior to the interim rule, so we're developing some more specific stuff. So again, that's when you go to our website, you go to training and front door strategies to get to some of that stuff.
Okay, let's try unmuting Beth Rosenberg and see if we can have her ask her question. Beth, we can hear you now? Okay, I guess that wasn't going to work. I'll read a question now. Could you please elaborate on disability services not being able to be mandatory?
So I don't want to say too much because I don't think I'm necessarily a great expert on this. This is sort of related to some of the issues with respect to Americans with Disabilities Act and fair housing, and so I know HUD was struggling with a lot of this stuff. But it's if you're providing disability related services, that participation in those services can't be mandatory as part of your program. They have to be voluntary services. So that's basically the rule there. So for example, if you're providing mental health services, that would be an example there. So for example, you couldn't say participation in mental health treatment as a requirement of continued stay in your permanent supportive housing project, for example.
Okay, I'm going to unmute Sharon Schaaf now to ask her question. Sharon, you want to go ahead? Hello, Sharon, we can hear you? Okay, I guess that won't work. Her question is, does the current interim regulation require that a homeless or formerly homeless person serve on a funded agency's board?
I'm sorry, could you can serve on what kind of agency's board?
Funded.
Yes, yes. So that is one of the requirements. So you currently or formerly homeless person will have to serve. So if you're a grant recipient or a subrecipient, so you have a Continuum of Care funded program that's funded by HUD, then yes, you have to have a currently or formerly homeless person on your board.
Okay. We're going to unmute William McMillan now. William, you want to ask your question?
It's actually Julie Maltzman who's listening for Bill.
Okay.
And will be taking his position. So glad to be part of Virginia's community now. In terms of the extra funding for administration, that is going to be added on to the current grant amounts, both for individual agencies with projects and also the admin. They're going to give that much. They're going to give that much more money. Not that you have to divert it from other lines, budget lines.
So yes, but let me just sort of go through all the nuances because I think they're important. So up to the 7%. So basically, when HUD calculates your renewal amount, the admin line will be 7%. So your renewal will be increased. There are a lot of things that sort of increase and decrease renewal amounts depending on the type of project you have. So this will increase your renewal amount and up to 7%. But if you want to go up to 10%, then they're not going to increase by that. So that you'd have to carve out of something else. And the 1.25% is also, and again, I didn't get a chance to look up the max yet for that amount. But the 1.25% for system-wide coordination, continuum of care-wide coordination, that is also sort of on top of the funding. So the answer is yes, up to 7%, but if you want to go to 10%, then no.
Okay, we have another question. if the COC uses the reallocation process to fund a new program, does that program then compete nationally with other programs?
So this is kind of a complicated question. Well, it's not that complicated. No, not really. So that new project has to meet threshold requirements. So that's a pretty, I don't want to say that's a pretty low standard, because then, you know, there are obviously a lot of people who don't necessarily meet the threshold requirements. But that's not the same as a bonus project where your COC has to score really well against the rest of the country. If you do a reallocation and you sort of follow the rules that HUD sets out for the reallocation, you just have to meet the threshold requirements. So you're doing a project like it's supposed to be done, but you're not competing against other COCs or other projects nationally when you do that. So the idea here is that there's not a disincentive to reallocate. I guess some people might worry that, well, what if we don't meet threshold? And so, you know, that would be a concern. But it's not like it's not a huge risk that you would be taking, say, if you, you know, like the risk of not getting a bonus project or something like that.
So there's a part 2 to this question. If a COC reallocates, for example, transitional housing shifts their program to a rapid rehousing program, can a COC decide to reallocate the dollars to that same agency?
Yes. Yeah. So you could, yes, you can reallocate to the same agency for a different project. Yes. The one thing I will say, the one thing about that you have to pay attention to is that if you're, with respect to this specific example, is rental assistance has to be administered by a public agency or a public housing authority. So if there's rental assistance involved in that rapid rehousing grant, then that would be, then it may get a little more complicated. You may have to, you know, be partnering with a local government agency or a public housing authority in the grant so that they're administering the rental assistance. But in general, yes, you can reallocate to the same organization.
We had a couple questions on that topic about the public housing authorities. One person would like to know if your county doesn't have a PHA, what other government unit should administer rental assistance, and how would that work? And would they also make a decision about the amount of rental assistance that's provided?
So, okay, so that kind of has two parts. So the first part is there are a lot of different agencies I've seen in other communities that administer rental assistance. So, and you know, I don't know the specifics of this example. So, you know, one is that there is typically in some larger communities, there's like a Department of Housing and Community Development that typically administers, for example, the home program that gets money from HUD, and money from that is currently often used for rental assistance. So they may. So what you're looking for, I think, is because any government agency can do it. It can be, you know, it can be the Department of Education. It could be the Department of whatever. But you're probably looking for someone with some experience doing this. So a Department of Housing and Community Development is a typical one. In some places I've seen it's the Department of Social Services that does this kind of work. One thing I would sort of look at is who is administering the ESG program for the community. And in some smaller places, that may be the state that's involved in that. So it's a state agency that can be involved in that, or you know, it can be. I guess it can kind of be anywhere in the local government. But I would first start looking at, is there a Department of Housing and Community Development, and then you know, sort of move out from there. Maybe see what other kinds of funding sources are used. Also, you know, I think there's. I think actually every part of Virginia is covered by that somebody sort of has, you know, if nothing else, it's the state that can that provides rental assistance for some of the more rural counties in the state. So, you know, that's another option to look at. But again, I think looking at your, going to your COC lead agency and is probably a good place to start with that. So the written standards part of the question is really something that, an agency is probably going to have to, the agency administering the program or the provider administering the program is obviously going to be deeply involved in this, but this is going to be a COC-wide COC sort of process to develop these standards. So it's not going to be just that organization that's involved in developing the standards. It's really going to be the entire COC that is going to have to approve and decide on what those standards are. And the idea is that they should be coordinated with the standards for the other programs in the community. So you should be able to look at any person who becomes homeless, sort of where do they fit into our system? What's our strategy for both for sheltering them short-term if they need shelter and for getting them back into permanent housing as quickly as possible. So it's really going to be a COC-wide process to develop those written standards.
Okay, to kind of shift gears a little bit, we have a question about are there any examples of communities who have integrated domestic violence data into their HMIS data? And they want to know how can they capture homeless domestic violence clients if domestic violence providers are not required to participate in HMIS?
So there are communities let me just sort of rephrase the question a bit, because it's not just that domestic violence providers are not required to participate in HMIS. In most cases, they're not allowed to participate in HMIS. So we actually wrote this up on our blog a little while ago. The example of Dayton, Ohio, which is a community that's sort of come up with a process for dealing with this, where they at the coordinated assessment center, they don't use any sort of identifying information for domestic violence survivors. They just use sort of an identifier, and it's only the domestic violence provider who can link that identifier with any particular individual. And then when that sort of identifier gets either comes up on a list, or there's another provider who's ready to assist them, then they make that link between the domestic violence provider and that other provider. So so they never have to actually enter data into HMIS at that point. The linkage is essentially made with that unique identifier, and I use the term unique identifier, but that's sort of an HMIS term as well. There's basically a number that people get that only the domestic violence provider knows how to link that with a person, and that's what's used to sort of make that referral process happen. So again, we wrote that up on our blog, which you can also access from our website. But and we're putting out some more materials. We publishing a domestic violence checklist for a coordinated assessment as well. But that's the way they do it. So Dayton, Ohio, I think, is actually a pretty good example of how this is integrated. They've been doing this for a while, and it's working pretty well.
Okay, this is a little bit of a community-specific question. I'm just going to read it verbatim. This individual would like to know, what is the role or purpose of the governing board? Are they supposed to replace the COC coalition? This community has co-chairs who meet with the full COC monthly, and the full COC votes on COC business. I hope that makes sense.
Yeah, so, so the governing board, so the COC and the COC governing board are two different things. So the COC is going to have broader participation than the COC governing board in general, but because and the thinking is in a lot of communities that are bigger, the COC is a very big body, and it's not something that can reasonably be expected to make governing decisions. So the governing board is supposed to be sort of a selection of that, a representative of that larger community, and so that would be the board. It's possible in some smaller places where the COC coalition or the COC membership is going to be small enough that maybe that you just end up that sort of becomes the board. Although I think in a lot of cases you probably want to think about who else can we bring in from the outside that can really strengthen our COC. Maybe some other funders, maybe some people who work for a local government or a PHA to really try to better integrate resources. But those are two sort of distinct and separate bodies. And I think the expectation is that both are, really have a role in making the COC work. So I hope that kind of answers the question.
Okay, and I have another community-specific question. What if going up to the 7% in admin fees for the renewals brings the total grant amount over the pro rata allowance?
Okay, so if the going up to 7% brings the whole community above, then you end up in hold harmless need status. So the reason for sort of crossing the line into hold harmless need status, it could be the admin, it could be rental costs, rental, because you have rental assistance grants, and the costs of those grants go up. They're adjusted for rental costs. Those make take you over the line, but it's entirely possible for an increase in admin costs to take you over your pro rata amount, and then you go into hold harmless need status, and basically that means you're still going to get all your grants renewed, but if you want a new grant, the only options for you are to either reallocate or to apply for a bonus project.
Here's another question. If a COC gets approval to serve people who are homeless as defined by other federal programs, for example, Department of Education, will these households have to be counted during the point-in-time count?
No. So the point-in-time count is going to remain essentially the same as what is required now. I think so I want to make a distinction here between what's sort of required of the point-in-time count and the fact that there are a lot of places that are trying to count everyone but don't necessarily get to everyone because it's just hard to do point-in-time counts. So the same category, you're still trying to capture the same categories of people in your point-in-time count. People who are unsheltered, people who are in emergency shelter or transitional housing programs. That's still the universe of people you're trying to capture in your point-in-time count. These additional categories, be it whether it's the additional people you're serving through the through that flexibility, if your COC goes that way, or you're not required to go out and try to do a census of people who are within 14 days of losing their housing or who are couch surfing or anything like that for the purpose of the point-in-time count. So the point-in-time count categories will remain the same and will not be affected. Obviously, the other things like who you're reporting on in your APRs and in your performance measurements in general, that is going to be affected by those things, but the point-in-time count will not. That said, HUD is always refining and trying to improve point-in-time count methodology and encouraging other people to improve point-in-time count methodology. Much of that is in the categories of A, trying to get more of the shelters in the point-in-time count, and B, trying to do a better job of finding unsheltered people. But that's not a change in the categories. It's just trying to improve methodology.
So someone would like some clarification. Can a supportive services only program be repurposed to include rental assistance?
Questions like that, I would say talk to your field office, but I'm pretty sure not. I think that would probably involve a reallocation because you're going from one program type to a different program type. You're going from a supportive services only project to essentially probably a rapid rehousing project, or possibly if you're doing permanent rental assistance to a permanent supportive housing project. So that's probably going to involve a reallocation process. But again, I really strongly encourage as a COC, it's good to always be talking to the HUD field office about what you want to do for a couple reasons. One is they'll give you some guidance, and two is that this is new for them too, and they don't necessarily know all the ins and outs of how everything's going to work, and it's helpful to give them a lot of lead time. So if they need to check with the headquarters office, or they really need to figure out, do some research to figure out, whether what you want to do is going to work, that they have the time to do that. So I always encourage talking to the field office, but I'm pretty sure in that example you're going to be looking at a reallocation.
Okay, well, we haven't gotten any new questions in a while, so I guess that might wrap up our webinar.
Okay, I will say, just looking at the question box up here, there are a couple questions. I noticed one from Josh about looking at the Alameda County data with HPRP money. Only 14% of households were homeless before receiving subsidies. The shelter and transitional housing stats start with 100% homelessness. Does it make sense to compare this data as if starting points were the same? This is something I didn't really clarify in the when we were looking at that slide. But in that case, the HPRP is just the rapid rehousing component of HPRP in that particular slide. They have other data that includes other categories. But I think I wanted to answer this question because I do think the point about really digging into data and looking at what's going on is a really important one. I wanted to bring up Alameda because they've done a good job at really sort of institutionalizing this idea of looking at data, and because they're obviously really far away, nobody's really, nobody's too personally invested in what their data is saying. But really that sort of analysis, looking at, okay, who's being served by these programs, what are the outcomes for different types of people. So, for example, if you look at all homeless people, or say all homeless individuals, and your shelters and transitional housing and rapid rehousing programs may perform one way. But if you look at people, say, with serious mental illness, they may perform differently. If you look at people with substance addictions, they may perform differently. And those are all things you should look at. And I really sort of wanted to point out the interaction between looking at your data and this coordinated assessment process. Those things should really work together well to improve overall performance. So that if you do find that programs are working really well for one type of person, that you can really make those things happen in the coordinated assessment process. So I just wanted to pull that out. Any other questions? Anna, have we had any more come in?
Sure, yes. So this individual would like to know, are there places where examples of governance charters for COCs can be found? This community has COC bylaws, and they'd like to know if these could be adopted as a governance charter.
I will say I am familiar with some examples of governance charters. I'm not sure I'm familiar with any I would necessarily recommend to people. I think these things sort of tend to have a life of their own, and they aren't necessarily created for the purpose of doing COC governance, which is why I think it's sort of a good idea to just, whatever structure you have, to look at it again and see if there's a better way to do it. There's nothing about the interim rule that suggests to me that you couldn't do it either through bylaws or a governance charter or something like that. So it doesn't seem to me, again, I want to stress that I'm not the last word on these kinds of things necessarily. And again, it's worth talking to your field office about this stuff. But I actually think that that's probably something that's worth looking at as a strategy. nothing suggests to me that that wouldn't work. So that was kind of a squishy answer. Sorry about that, but that's the best I can do. But if you're looking for sort of examples of, I guess the best thing to probably do is to really look at some of the, I mean, one of the things I would suggest is I know a lot of the COCs in Virginia talk to each other and spend some, share some information, and there are some good COCs in some well-functioning COCs in Virginia. Well, I'm sure they're all very well-functioning, of course, but some people probably have some examples of bylaws and charters that they would share with you, and it's probably worth talking to your neighbors around the state.
Okay, we have a definition of homelessness question. It's a little bit of a specific example. So this person would like to know if a person is homeless and then enters a nursing home, can they apply for assistance while they're in the nursing home? And if they exit after 90 days, does the individual qualify for homeless assistance?
So, and just for a little background of why this person suggested 90 days, there's actually sort of this rule in the definition, or this clause in the definition, which says that if you were homeless and then you enter some kind of an institutional setting for up to 90 days and then exit, that you're homeless when you exit that institutional setting. So what this person is asking about is, what about the circumstances where it's for more than 90 days? And I don't know the answer to that. I do know that they're eligible for prevention assistance under the ESG program. I'm not sure about under what circumstances they could qualify for homeless assistance. I think that's it's probably worth digging into the rule a little bit. I vaguely recall that it covered some of that territory, but I don't remember precisely what it says. So I don't want to speak without really knowing the answer to that. Sorry about that.
I have another sort of specific question. This person would like to know, you mentioned that the COC can use funding for planning activities with their board. Did you say that it was 1 1/4%?
Yes, it's 1 1/4% of the final pro rata need. So if you're in hold harmless status, then it's your hold harmless. If you're in not in hold harmless, then it's your pro rata need. So 1 1/4% of that amount is the amount you can use for essentially for the COC lead agency to do planning and coordination activities. Now it's 1 1/4%, except there's a minimum. I think it's 10,000. I should have. I apologize. I should have checked this before I did this call. But there's a minimum, and I think it's 10,000, and there's also a maximum amount. And it's obviously a lot larger than 10%, 10,000. So for some of the really big or some of the really small COCs, it's going to be more or less than 1 1/4%, but for most of them, it'll be 1 1/4%.
I have a domestic violence provider who has a question about using HMIS. They'd really like to use HMIS, but they've been told that they're not allowed to. Is that true? And if so, where can this person find some assistance in using HMIS for their program?
So the rule is basically that if you are a domestic violence, if you're a domestic violence services provider, that primarily domestic violence services provider, that you're not allowed to use HMIS, and that you're instead supposed to use a comparable database. And the comparable database guidelines are similar to what they were in HPRP. So if you're familiar with domestic violence providers who worked with HPRP funding, then that's probably a way to get some guidance about how you can do that. So yes, it is true that you're not putting data into HMIS, and there's actually a federal law that requires that you not be allowed to put data into HMIS, but that you will use a different database to provide aggregated information to the COC for the purposes of the application and for planning purposes and stuff like that. But that's non-identifying, so it's not client-level information. So again, the HUD has some guidance about what constitutes a comparable database, but what I would do is I would talk to whoever administered HPRP in your community, because I think a lot of the COCs in Virginia, the domestic violence providers got some HPRP funding and were required to use the, and it wasn't just HMIS providers. I think some legal services providers also used comparable databases, so they can probably give you a sense of what databases they're using and what and how that all works, and give you some guidance about that.
We have a couple questions about the definition. Oh, sorry, go ahead.
And then there are a couple nuances here. It's not for domestic violence survivors that you can't use HMIS. It's that if you're primarily a domestic violence provider, victim services provider, that you and the people you're serving can't be entered into HMIS. So there will be other programs that are serving just by nature of, obviously a lot of people who are homeless, who experience homelessness, also experience domestic violence. And so in any sort of regular shelter program or other kinds of homeless assistance program, they may even provide some victim services, but because they're not primarily a victim service provider, they will be putting data into HMIS, and they'll continue to put data into HMIS. So the division line here is not about whether the person is a survivor of domestic violence, it's whether the program primarily does victim services or not. I just wanted to clarify. I think the questioner knows this very well, but I just wanted to clarify for other people on the call.
Okay. We have some questions about the definition of homelessness again. This individual would like to know how the definition of homelessness impacts the definition of chronic homelessness.
There are some changes to the definition. Not much, not at all possibly. There are some changes to the definition of chronic homelessness. So those are things that obviously, that's its own thing. But to sort of really be literal about the question, I don't think there's really any interaction between the expanded definition of homelessness and the definition of chronic homelessness. However, the changes to the definition of chronic homelessness are that if you are a family with children and the adult in the household sort of otherwise meets the definition of chronic homelessness, then the whole family is. So just the fact that you're chronically homeless and have kids with you doesn't mean you're no longer chronically homeless because you have kids with you. Your whole household would be considered a chronically homeless family. So that's changed. There are the interim rule actually. So the HUD put out some guidance about the definition of chronic homelessness. HUD put out an interim regulation that included a revised definition of chronic homelessness that basically said that each episode of homelessness, for people who are homeless 4 times in the past 3 years, each episode of homelessness had to be at least 15 days. They've now said that that's no longer the case. They've gone back to leaving it vague and leaving it up to communities. So that's one change to the definition of chronic homelessness. The reason the new expanded definition of homelessness doesn't impact the definition of chronic homelessness is that the definition of chronic homelessness is keyed on whether a person is in emergency shelter or in an unsheltered situation, not just whether they're homeless continuously for a year or whether they're homeless 4 times in the past 3 years, but whether they were in emergency shelter or unsheltered either continuously for a year or for the 4 times in the past 3 years. So, and since the definition of who is in emergency shelter and who is unsheltered has not changed, that's not going to change the definition of chronic homelessness. I hope that answers that question. That was kind of a complicated one.
Okay. Well, it looks like we haven't gotten any new questions in a while.
Okay. Well, I just want to quickly say thank you to everyone for participating in the webinar. Sorry we couldn't quite get as much of the audience interaction working as we wanted to, but we'll keep working on that. If you continue to have questions, though, I didn't put it up on my slide for some reason, but let me give you my email address and also Anna's email address. So my email address is N Suchar, that's N as in Norm, S as in Sam, UCHAR at naeh.org. And Anna, do you want to give yours?
Sure. It's ABLASCO at naeh.org. We'll also send a recording of this webinar out via email after it is finished.
And again, thank you, and have a great rest of your day and a great weekend, everybody.